how does your work in plant-based nutrition really fit in with your current practice as a hematologist, Shireen, and as a radiologist, Zahra? Shireen, why don't you go first and tell us about how do you bring the two together? Is it even possible?
Yes, thanks for asking. And yeah, it's so possible because the problems I face for my patients are that not only are you trying to treat lymphoma, so cancer of the lymphatic system, not necessarily lifestyle related, not necessarily preventable, but what each and every one of my patients has is some other chronic underlying condition, the commonest ones that are prevalent in our society today: high blood pressure, high cholesterol, pre-diabetes or diabetes, or known cardiovascular disease, carrying unhealthy amounts of body weight, fatty liver disease. So these illnesses are present in my patients, and that makes my life a little more tricky than it needs to be, because people tolerate treatment less well, have greater side effects, and the longer term outcome is negatively impacted by having these chronic health conditions. So it really is a teachable moment when I meet my patients. It's difficult, it's a challenge, and you have to meet people where they are. People have to be ready to take on this information. So I can't suggest that I'm successful in every case, but there is the opportunity to plant a seed for healthy plant-based diets and lifestyles. And we're very lucky in the cancer space. As you know, the World Cancer Research Fund guidelines clearly state that a healthy diet for cancer prevention and for surviving well after cancer involves eating a diet that is centered around fruits, vegetables, whole grains, and legumes. And so I'm able to give that information, and then hopefully some, helpful tips for the individual patient that's relevant for them in their social and cultural context, and taking on board their financial constraints too.
Absolutely. And have you encountered any situation, where you're consulting with a patient and the patient's like, you know what, doc, just give me the pill. Just tell me what surgical intervention I need. I couldn't be bothered with lifestyle change. How do you deal with those situations?
Yeah, I mean, I think people are very receptive to this information. It's not that they can't be bothered or don't want to give it a try, but there are real challenges. The area that I work in, London, is a real mix of those that have and those that have not. There's a migrant community, people who are worrying about housing, that will lose their job because they can no longer turn up to work because they're having chemotherapy at the hospital. So those are the challenges. I mean, there's never any resistance to understanding that eating more fruits and vegetables are healthy. People know this intuitively, so it's not a surprise for them to hear. Obviously, talking about things like eggs and dairy and making more healthful swaps is a bit more challenging. But I think it's the sort of systemic, sort of social and cultural contexts that make things challenging.
Right. Okay. Thank you for that. Zahra, how about yourself? Radiation oncology. People come to you when they're desperate, I guess, almost, and there's cancer, and we know cancers can be sometimes very aggressive, and surgical interventions are important, radiology and all of those things. How do you talk to them about lifestyle changes?
I talk to all of my patients, really, or the majority of my patients, about lifestyle measures at the time that I see people as a new patient. So I actually add on an extra 15 minutes to my consult. I usually go over because I talk so much, but it's a really teachable moment, and people are asking for that information. As Shireen says, people are receptive. Of course, there are people who are not going to be receptive, and you hope that you're planting the seed in those circumstances, and when the time is right for them, they will come back to that. So I talk to my patients because I think, and I tell them, I think lifestyle measures are just as important as the conventional treatments that we're talking to you about. We never do either or. It's never instead of the conventional treatments, but it is equally important, because we know that 40% of our cancers are caused by our lifestyle choices. And not only that, but unfortunately, if you've had one cancer, you are at higher risk of developing a new cancer above the general population. You So that piece is important. So we know that lifestyle measures can reduce the incidence of cancer. We know that pursuing good lifestyle measures can help you tolerate the side effects of treatment, improve your quality of life, improve your mood and anxiety symptoms and depressive symptoms. And we know that in survivorship, that undertaking those healthy lifestyle measures can reduce your risk of cancer recurrence, can help improve your outcomes. We also know that that advice that we give is the same for reducing the risk of any chronic disease.
Yeah.
And unfortunately, we know that having a chronic disease increases your risk of getting cancer. Having chronic disease increases your risk of dying of cancer.
Yeah.
And our treatments also induce these problems as well. You know, our chemotherapies and radiation can increase your risk of heart disease. But the advice is exactly the same. I mean, that's the beauty of it, that, you know, eat a healthy plant-based diet. And as Shireen says, you know, our international cancer guidelines state that have a diet that is rich in fruits, vegetables, whole grains, legumes, nuts and seeds, and maintain a healthy body weight. Do some physical exercise. Avoid risky substances. You know, don't smoke. We have big anti-smoking programs within the cancer center. We tell our patients alcohol is a class 1 cancer-causing agent. You know, that message is not getting out there, but you know, and my patients who have breast cancer are always surprised when I tell them that, you know, about 8% of all breast cancers are caused by alcohol use, and people don't know that. So it's a great moment to teach them. And we talk about, you know, how good sleep and stress management is so important during this time. So I do take that time, and it is only 20 minutes. I don't have resources. Shireen doesn't have resources to then help people on that journey any more than that. I have Michelle, the co-founder of Plant-Based Canada, who's a plant-based dietitian who I refer my patients to if they want further information, and we have written resources to point them to. So most people are really receptive. Most people are asking for that advice. And I also find that people are so grateful for it, and you can see their anxiety levels come down.
Okay.
So even when I'm speaking to someone and I can feel that barrier when I'm talking about all the standard treatments, and I'm thinking, you know, do I take extra time to speak to this patient about this, or do I let them go because they're just clearly not wanting to be here?
Right.
But when I do, I see that anxiety level come down. It speaks to a different part of people, and I hope they feel some hope because it gives them some power back as well.